Hey everybody, this is Jessica again, and this presentation is going to be going over handoff reports. So what are they? What is a handoff report? A handoff report is essentially an exchange of vital patient information, responsibility, and accountability between the offgoing and oncoming nurses in order to continue safe care and best practices. The number one method of giving handoff report is face-to-face at bedside, even though you might not see nurses always do this. It allows for a private setting and patient and family input, and it also improves patient experience. There are two different content types for handoff reports. First is the full handoff report. This is given when the oncoming nurse is new to the patient, so perhaps the beginning of their shift and they had never had that patient before, or maybe the nurse is admitting the patient and hasn't had that patient before. Next is the abbreviated handoff report. Now this should only be done when a nurse is returning after having that patient recently. And I don't mean having that patient a week ago, I mean they worked night shift and now they're back the next night. Allows you to only give them things like updates, what happened during the day. So what's included in a full handoff report? First, you want to introduce the patient. You want to say their room number, their code status, any allergies that they might have, advanced directives and where can that nurse find them, and finally contact information. Now I don't always mean the patient's contact information. A lot of times this is pertinent family contact information, especially if the patient can't make medical decisions themselves. Next, you want to give background information, like what is the admitting diagnosis versus what's the current diagnosis. Sometimes patients are in the hospital for long enough that their admitting diagnosis isn't actually what's currently happening to them at this time. So what's current diagnosis? And also, what's their pertinent medical history? The bulk of your handoff report is going to be going over assessment information. This is things like any pertinent vital signs. Now, the new nurse probably doesn't need to know if all the vital signs are normal. You can just say all vital signs were stable. But if they're having a high blood pressure or their oxygen sats were low, these are things you want to mention to the nurse. You want to go over your body system assessments, the neurological, are they on room air, how does their lungs sound, have they been able to go to the bathroom, things like that. You want to tell them their last bowel movement. A lot of nurses want to know this because they want to know if the patient's constipated or are they having diarrhea so that they can go ahead and plan their care for that day. You want to go over activities of daily living. What did the patient do today? Did they take a shower? Did they brush their teeth? Are they able to do that themselves? Do they need help? Do they need that done during your shift? What's their mobility status? Is this patient a fall risk? Can they get up? If they can get up, is it with a walker, one person assist, two person assist, short distance, long distance? If they had a stroke, is one side weak? What's the diet orders? Are they on a regular diet, a diabetic diet, a low salt diet? Do they have any trouble swallowing? Does their food need to be chopped? Do they need help eating? Pain management. How has that patient's pain been? If they have pain, where is it? What did you give for it? Which leads us to pertinent medications. If you gave something for pain, what was it? When was the last time? And when is it available again? Was there any other pertinent medications, IV or otherwise, that the nurse might need to know going into their shift? Maybe it's still running. What are pertinent lab results? Did that patient have a low potassium? A low hemoglobin? What are lines, drains, and tubes that this patient has? Do they have a Foley catheter? Do they have a peripheral IV, a central IV? Where is it? Do they have something like a colostomy? In addition to the stuff we've already gone over, you're going to probably want to mention the following. What kind of pertinent care did you provide during that shift that you might not have mentioned already? Were there any pertinent events during that shift? Did you have to call a rapid response? A code? Did the patient fall? What's the patient plan of care for their stay? Are they here because they need antibiotics? Why are they still here? And also, what's their discharge plan? Are they going to be going home? Are they going to need home health? Are they going to be going to a skilled nursing facility or an assisted nursing facility? Has that been figured out yet? Do we know when? And that's it. That's pretty much the content of your handoff report. A lot of new nurses and students get nervous giving handoff reports, so here's some tips. Develop your nursing brain. Organize your nursing brain to tailor to your report. Make it specific to you and how you'd want to give report and how you remember information. Have a system. This goes along with what I just said. Have an order that you go in. That way, if something happens and you have to stop mid-report or there's questions or something like that, you're very organized and you know where you left off and what you're going to next. And that way you don't forget things. Review. If you have time, and I recognize you do not always have time, during your shift, review the information or write it down either on your nursing brain or in your documented nursing note to refresh your memory. That way you have something to go back on. And stop interruptions. It's not always possible, but it is okay that if there's a non-urgent interruption to ask either the nurse you're giving report to or maybe another nurse or person interrupting if they just don't mind waiting until you're done with your report. That's it. Thank you for listening. Hopefully this alleviates some of your concerns about giving a handoff report. If you have any questions, please feel free to reach out to me. Here's my email address and my phone number.